Proper cancer management has been said to be a panacea to a healthy life. And the earlier you study management, the better for us in Nigeria. And these were the submissions of my guests last week on your image. This week, we are continuing with PR approach to cancer management in Nigeria. I still have my guests in the studios with me. Mrs. Omolara Fajabi is a palliative nurse at the Federal Medical Center, Abeokuta. You're welcome this week.
Thank you very much.
Joining the conversation this week also is our clinical psychologist, Mr. Tomi Ayoshola, also from FMC, Abeokuta. You are welcome to the show this week.
Thank you very much.
Now, last week, you mentioned some of the areas where one can be a victim of a cancer. One that you mentioned is a clean environment, that we should always keep a clean environment. But now I want to ask, we have been talking about cancer, and the management, like you said, is very poor. Don't we have proper equipment that can ameliorate this, that can speed up the treatment in Nigeria? Because there are a lot of people who are victims, but they are limited by equipment at various hospitals.
Thank you very much. We have equipment in Nigeria, but the problem we have in this country is that some of the equipments, some of the machines are outdated.
Wow. And
the number of the people having cancer, it has outweighed even the machines that are even working. Can you imagine? You have to queue before you can have radiotherapy done in some institution in Nigeria. You have to even book. And maybe by the time the patient is waiting, the patient might die.
Wow.
That is how bad I will not say the institutions, but the treatment of cancer is. Because the things we need, the equipment we need are not readily available. They are not readily available. We don't have sufficient ones, except maybe in few private hospitals, not in government hospitals.
Now, like she mentioned, sir, that people who are not really, who are not rich enough to travel out of the country to treat cancer, then that means they are prone to early death. What's the opinion about this?
It's very true. They are prone to early death, but there is a way out for all. Number one, we have to calm down. Though we have absolute equipment, like she said, but I believe having proper education is very essential. I don't have money, but if at the onset, I always mention the onset of life. It's well done. It's well calculated. There's no way to run here and there. You are expecting some donor from here and there. For example, American Cancer Association. Nigeria too, we are trying in the area of cancer just coming up. My own take is that though we have absolute equipment, though we don't have finance, there is need for us to start from the rear, from the local, especially in the area of what we eat. If you know in future you won't have money to spend on cancer, there is need for you to curb yourself, curb your lifestyle.
In what sense? What are those things that we should be hitting? What are those things that we should avoid as a people?
For example, the intake of vegetables is very essential. All those canned food, all those untidy foods. Some of our women will go to markets, will go and buy what they call it, breaking tomato, break up onions and go. All those are not good for the body. And also, we should drink water, good water. Allow some of this material to go out of the system. For example, someone that's having prostate cancer, having prostate cancer, literatures have shown the use of tomato, avoiding things like sugary materials and oily food. It helps a lot. There was a study that I read about the use of onions, breaking onions into fragments, turning into juice, and early in the morning you take it. This may not be proven, but with the literature was telling me that some people have done it and it reduced their level of prostate cancer. On part of women, like she said, ensuring that the breast is well taken care of, knowing there is lump there. Those are the areas. If I don't have money for, the issue of chemotherapy or the use of machine, like on the laser machine to kill the cancer.
Now, what are those, you mentioned food, that one should be careful of what one eats. So what are the category of foods one should eat, and what are those ones that should be avoided?
Number one, proteinous food. Too much proteinous food is not so good.
Really?
For the body. Yes. They are essential, like oily food.
Okay.
Depending on, like she was saying something, obesity is one of the risk factor of cancer. The more you take this thing in, the more your body is prone to all these cancerous agents, because they like to suck those things because it benefits their life for them to grow. So you should avoid this. Then one should take to exercise. Aerobic exercise is very essential whenever you are doing this. Then there is this mind meditation too. It helps also. In psychological parlance, you sit down, you meditate, you try to browse what you have done in life. In psychology, as a clinical psychologist, we teach what we call problem-solving technique. If I go out in a day, how do I solve my problems? You define the problem, you create an alternative. Before you know it, you are buffet. So that your mind is at rest, because mind is very essential. We are product of our thoughts. So also, the moment your thought process is affected, there's tendency for the body immunity to go down.
Wow.
And that is why you are no longer a candidate of depression. When your mind is lifted, depression goes, anxiety reduces. Then body immunity comes up. So those are the mechanism of the body is very strange. The interpretation of the brain to issues we do is very essential. It affects our behavior. Wow. Every act we do affects our behavior. So
meaning that as a professional, one should kind of undergo psychological talk all the time.
Exactly. We, like me, like every year I brief myself, I go to experts, the senior colleagues, to debrief. In the military they call something debriefing. I've heard stories, I do psychotherapy for people. Before I know it right now, I pass the anxiety to myself. Because as a natural human being, I can carry the body of others. So I have to debrief myself.
Wow.
So it's very essential. And that's why I want to tell people there is need for us to periodically go to hospitals to check our status, whether we are sick or we are not sick. And the room is open. For example, yesterday we have started a seminar trying to educate people on this issue of cancer.
Okay, let me go to Mrs. Fajobi. As professionals, as health practitioners, what is your role in the era of public enlightenment to the people? You mentioned a program now. What is your role per se, your duty to the people? Of course, you may be handicapped with equipment, but personally, what should be your primary duty to the people, irrespective of the government agency that you work for, as humanitarian people who discharge service to the people, irrespective of their background?
I am a palliative specialist. I'm a palliative nurse, and we communicate a lot. In our communication, we try to support our patients about their disease condition. We have family conferences when we see that they are so burdened about the condition, and they cannot, some don't want to tell anybody. So yes, they want to hide it within themselves and they want to suffer alone. So in that wise, we speak with them as a specialist. We have support groups. In this support group, we go home visiting. Every Thursdays, we go to their homes, to those that are suffering from cancer, especially those that are bedridden, those that don't have anybody to lean on. They lean on us. We support them. We give them respite. We give them counseling. We support their families. We give them information. Though financially we might not be able to support them. But as a palliative nurse, we do something, we relieve them of their pains. We have different type of pains. We have the emotional, the psychological, we have the physical pain. That's one that they get from the disease condition they have. We have so many symptoms that we control. They might have nausea and vomiting, which makes them so unhappy. You know, as they eat or at the sight of any odor, they start vomiting. It could be as a result of the disease condition, or it could be as a result of the drugs they are taking. So we support them, we relieve them of their symptoms. We make them to live a qualitative life. Even though death is imminent, even though death is coming, we make them to be fulfilled, self-actualization. We make them to have self-actualization that though it might be soon, but you have achieved this. We support them even till death. Even after death, we support the family in the bereavement period.
All right, this is your image PR approach to cancer management in Nigeria. My guests have been Mr. Tomi Ayoshola, clinical psychologist, FMC Abeokuta, and of course, Mrs. Omolara Fajobi, a palliative nurse. I want to do a comparative analysis of health management in Nigeria and to other countries abroad. Let's do a critical analysis of the two. Somebody said some time ago that if a lifespan in Nigeria is probably 50 years, and if you happen to be born abroad in any European countries, you may live up to 80 or 100 years. What's your opinion about this as far as health management is concerned?
Well, I want to prove those people, I want to say no. Why? Because there is deviation from the local standard. Our fathers, in the days of old, they lived successfully based on what they eat. Okay. What gave us problem is what we eat. Though life standard of life, because of their like we just discussed yesterday, we're talking about when you are doing a comparison analysis, talking about those ones of us, they are fortunate. Why? Because of the high level of technology. But here too, we have a local tech which we are not adhering to in terms of the way of life of our fathers. If we cannot beat them, there is need for us. There was supposed to be a paradigm shift. You know, people move forward. We can go backward because our backward is same. It appears as if our backward is better than the forward. So let's go to the village analysis, village way of doing things, and that one we equate the technology that is obtainable up there. I think that's my own simple African psychology.
Mrs. Fajobi, the program we had last week, somebody sent a question to me, and I promised I will ask you. And it has to do with that. When you said our exposure to certain things could cause cancer, like
rays of, yes.
Now said, what about these phones that we use? These mobile phones that we use, earphones that we use, we move them close to us. Is it not likely to be a major cause of cancer?
I think there are some of the phones, the radioactive elements in them are so high that they emit so much radium on our body. And most of the time, we are not supposed to be carrying the phone on our, especially for the men, in their pockets.
Wow.
Or some, you can see some market women, they are so ignorant that they put it even in their breasts.
Yes. To keep.
No.
Yeah, of course. When they are in the marketplace,
yes,
they believe that's the best place for them to keep.
When it beams, they pick it up from their breasts. Those phones are carrying, I'm sure they are carrying some carcinogenic agents. Because there are some radiums that, you know, enters into, when somebody calls you, there is some radium that comes out and, you know, you get infected or it gets stick to your body. And if it accumulates so much and your body cannot clean them off, then eventually they become cancers. Because there was a time we had a woman, she went outside the country to have her treatment. So she was warning us that something they told her outside the country was that don't put your phone in your pocket, put it in your bags.
Wow.
Yes. that we are not supposed to be carrying it around in our arms or in our pocket or in our breast is awful. It's not right.
So how do we now carry the phone?
The phone.
And some people, sorry, I'm sorry, and some people even sleep, put the phone beside them or beside their pillow.
And you see
when
them
they sleep.
charging it.
Some do charge, but some put it underneath their pillows when they sleep.
We have some patients some few months back.
Okay.
And one, I want just to support my what I've said earlier about emitting some radium. While he was doing some work on a Nepal cable,
Okay.
the phone just beamed and it caught fire. So definitely some radiums are being emitted from it. Okay. So we should not keep them in our pockets. The ladies can keep them in their handbags, and the men, they do have some purse. You can keep it in your purse or keep it very close to where you can hear it when it beams. So that at least we free ourselves from being just carrying out being infected with.
So is that the best way to clean ourselves of
at least
cancer?
We have to look for preventive measures.
Okay.
There are so many preventive measures.
Okay.
Exposure to radiums, radiation causes cancer.
Okay. All right. So you mentioned the one association the other time. When you have something like that, as big as it is, and then you come up with a report, do you make your report available to government and relevant health agencies?
Already we are in the committee that was set up to put up this program. We are set up a communique committee that's going to summarize the executive summary of what will happen,
yes,
or what is happening.
And do you make such communique available to the press so that people can know what you actually went there to do?
We'll be glad. I don't know, with due respect, we can use this forum to bring out the outcome of the resolution of our the symposium. So we appreciate us if we can use this forum to highlight some of these things. I want to put in something which is very essential. We don't have technology and go. That's what we call in psychology adjustment to illness. People should try to adjust. The moment the evil man has done his own, there's need for you to adjust. The higher your adjustment level, the higher your quality of life. Literature is proving. And the higher your self-esteem or self-efficacy, the more you have resilience attitude to withstand the onslaught of those carcinogenic agents.
Wow. Public relations approach to cancer management in Nigeria. It's as if we should not, if we just continue with the program, and because so many people sent messages last week and they said they need to know more about this, and they even request that we bring our guests back to the show. Mrs. Fajobi, I want to be particular about breast cancer now, for the sake of our women, for the sake of our mothers, our sisters who are home. What should be the pre-measures? The pre-measure, yes, that they should, because this thing is, I think they are more prone to. They are more prone because they will breastfeed children. They are exposed to so many things. What advice will you have for them? What steps should they be taking on a daily basis? You mentioned something last week that after their menses, 3 days after their menses, they should take time to. Some people say it should be on a daily basis. What is your argument on this?
It's not on a daily basis.
Okay.
Because before the menstrual cycle, there will be changes in the body, and the breast becomes tender.
Okay.
It becomes tender, and you might not really feel anything, or you might feel some things that after the menses it disappears. So it's just 3 to 5 days after the menstruation. You stand on the mirror, you do a self-breast check.
Okay.
You can lie down and also do a breast check. You will use your left hand to support the right breast and massage it to check if there is any abnormality or if there is a lump in the breast. Then you check it even to the axilla, to the armpits, to check if there is something strange there. Because at times you can find a lump underneath the armpits, because that part is the tail of the breast. Then after that, you can stand in front of the mirror, check the breast. Is there something different? Is the breast symmetric? Is it on the same level, or one is bigger than the other and so obvious? Is it that the breast is hard to touch? Because at times you see some ladies, their breast is very hard, as if it's stone. It could be diseased. And at times when they press the breast, you can press out breast milk without
lactation?
Without lactating, yes. It happens. Is another topic entirely. Yes. Or you press the nipple and blood comes out.
Okay.
It could be that there is a problem.
Okay.
In that wise, you see the doctor. You don't have to keep to yourself. Especially our ladies out there, they keep silence. Our mothers don't want to tell anybody that something is wrong with them until when the breast start bringing out or started oozing or it sloughs. It has a wound. Deteriorating, yes. That is, most of the time when our women come to the hospital, they come at the level that is so pathetic.
Wow.
Yes. And the husband might tell you that she never tells me that she's going through all this.
All right, to balance the discussion, Mr. Anshola, now let me go to the men folk. When we were small, when we were young boys in school, you know, either you went to university, you travel far and far, and it was like a competition among us. And literature says that the more you grow, the less your urine travels. Is this an omen to prostrate, or is the law of nature?
It's not law of nature. Age factor is one of the risk factors. The older you are, the more you are prone, especially when your lifestyle is anti-good health. So it's there. That's why I said we just have to be educative. I mean, you have to allow yourself to allow education to enter your system. Okay. When you are growing older, and the age factor, as from 40, watch your lifestyle as a man. 50, another, 60. And at that point in time, there is an argument against literature talk about sexual activities. When men, the less you involve in sexual activities, the more you are prone to prostate cancer.
Is that true?
There are some people. The literature is unscientific because it's not yet proven.
It's not proven. Okay.
Or the most important thing is lifestyle modification. And that literature even go further that all these fathers, the Enoch, because they are not involved in sexual activities, they are prone to prostate cancer. Lifestyle is very essential, especially when we are aging. Please, for the public, I would like you to go and check your prostate as from 40, 45, and know the kind of food you eat. Abstain from the use of substance, especially alcohol. Very dangerous. And it's one of those things that normally ignite those
smoking
agents. Smoking also.
Yes. Before we round off, this is very important. In men, what are the symptoms of prostate cancer?
Number one, inability to do that thing we normally do.
In the primary young, when your unit travels.
That's it. Okay. Number two, back pain. Understand? You experience back pain.
Okay.
Sometimes insomnia, consistent insomnia. Insomnia is not diagnosed until after 2 weeks.
Wow. And what is that insomnia?
Insomnia means poor sleep.
Okay, inability to sleep very well.
Very well.
Sleep. Okay.
Sometimes you sleep more, there is a disorder. If you sleep more than 7, 8 hours, you are sleeping at 12, you are knocking the door of depression. If you sleep less, around 3 to 4 hours, that's depression. And all these are activities. Because body system will not be effective, the mechanism will be truncated if sleep is not done very well. And I want to point it out. One of the areas to show that there's a problem with you is when you have problem with sleep. Our system, the sleep REM, the issue of alpha and beta, because of the program, I know I explained so much. Okay. There's a REM of sleep. If you're unable to attain that REM as you ought to, working with time, you may have problem. So there's need for us to watch the way we do our sleeping. And we should avoid using all these sleeping tablets, they call it. Develop the attitude, do muscle relaxation technique. Do you understand me? Avoid stress.
Okay.
Bath as at when due. Do the necessary thing. Involve your brain in clinical activities.
Your final take on this show.
I want to advise our mothers out there to take care of their daughters, to ensure they counsel them on how to take care of their breasts, of their reproductive organs, especially the breast and the vagina and the cervix, because we have more of cervical cancer and breast cancer. So we should take care of ourselves, ensure that you counsel them and you show them how to do it, and they do it regularly.
Marvel, this is a fantastic addition so far, because it's one of the programs that is how to enlighten our people, to educate them, especially in the way we live our life, a healthy life for that matter. I want to say a very big thank you to Mrs. Omolara Fajobi. And I want to thank our clinical psychologist, Mr. Tomi Ayonshola. Also from FMC, we really appreciate your wealth of experience. And to our viewers, we appreciate you for being part of the show, PR Approach to Cancer Management in Nigeria. Until we meet next week, God willing, let's take time to take good care of our health. See you next week.